Okay, so let's continue our discussion. So next will be role transition. So after grief, no. So first one is about grief or ato ang uh, the way we long for someone we love or someone we lost. Okay, next is role transition. So have we ever tried nga nang dili nimo role before, then kalit lang ka nagkaroon ng responsibility to perform a role, no? So karang for example, karibang ah i-connect na lang nato dito sa una which is ang grief. Ikaw as parent, no? Namatay ang imuhang partner. So before imuhang partner ang gatrabaho para sa family, nag-earn para sa family. Because of sa iyahang pagkawala, ang role niya as father or as mother, imuha ng cargo. So kumbaga, sometimes, uh, stress or depression are caused by role transition. So especially pag wala tay igong idea about that role or we do not have enough skills to perform such role. Okay? Role transitions are situations in which the patient has to adapt to a change in life circumstances. Some are planned for and some are not. Kumbaga, some of our patients having depression caused by role transition. Kumbaga, we are still or ang ato ang client ba or kita mismo still adapting to the new role nga ato ang i-perform. So examples of developmental changes are going to college, no? Pag abot na to og college, gikan sa una, nga high school pa ta, excited kayo ta. No? Excited kayo ta. And sometimes pag lapit ng klase di na ta katulog because we are overthinking unsa kaya ang feeling or unsa kaya ang sa college. No, so nga na siya. Or karing ang imuhabang role as student compared before is mas stricto ba or mas lisod ba? Right? That's because pag high school chill-chill. Pag abot og college, grabe nga stress. So nga na, getting engaged or married, separating or divorcing, dealing with difficult children, or having a child leave the home. Okay? So maliban na we have getting engaged, no? Karang engaged na ka sa isa ka tao. Of course, mong huna-huna gasto para sa kasal, kano sa ang kasal, no? Imuhang mga anak kung nagkaanak mo before engagement. Tinga na siya. And of course, behavior sa imuhang partner. Tinga na. Divorcing or karing separation. No? As I said a while ago, katong namatyan iyang bana or magbulag sa iyang bana. Di ba? There are people or there are kumbaga tao gani nga they cannot agree with their partner nga magbulag na lang. That's because they are kumbaga questioning paano nila buhion ang ilang anak. So for example, because ang role ba sa ilahang papa as the earner for the family is dili niya ma-perform tungod kay ang iya pong anak kinsay magbantay. So, 'di ba? That's why sometimes people nga nasa nga situation magtiis na lang. Bisag ginabunog sila silahang partner no tungod kay dili sila makipagbulag, tungod kay dili nila maano ang role, then ginatiis na lang nila. Sometimes role transitions have to do with work, such as trying to find a job, dealing with promotion or demotion, or being fired or laid off. So, in role transition from one role to another role, or ang imuhang role nadagdagan og iba nga role, multiple roles, or you are having some uh, kumbaga ang kara nga role is nawala sa imuha. Like for example, natanggal ka sa trabaho. So your role is employee. Natanggal ka sa trabaho. So mag-adjust na pug ka sa situation nga wala kay trabaho. So nga na. So unemployment is one of the kumbaga pinaka dakong problema sa Philippines karon. So nga na siya. Transition to have to do with work. Kumbaga karang bag-o ka na hire sa trabaho. So unsa na pod ang problema ana from katong wala kay role kayo nga gina-perform before karon magkaroon ka og role. Like for or in what situation? So, like for example, sa una, ikaw as teacher, student ra ka. No, student ka. Tapos pag-apply nimo og trabaho, teacher na ka. Naadjud kay feeling nga especially for example sa ako dili man ko teacher by profession because I am a social work by profession. I am a social worker by profession. So, kumbaga, wala ko enough nga knowledge about teaching or enough nga skills about teaching. So, nga na. So, karon first day of class, kinang-apply ka as teacher. Dako kayo ang pagka-shock nimo, ay nga ni di ang feeling, ay nga ni di ang kinahanglan. Hala, uy, deliver ka og enough nga knowledge. Hala, uy, kumusta kaya ako ang performance sa teacher? So ikaw as teacher ikaw as person nga naay bag-ong roles or sa imuhang work, di ba? Ma-shock nga ka. Or you have to adapt hinay-hinay. Sometimes that will result to stress, no? And if maano nimo nga dili gud satisfied ang imuhang student sa imong performance, then sometimes people do not strive. They surrender. So na pod sila bag-ong role nga i-perform, which is walay trabaho kay nag-resign. So nga na. Okay? So having promotion, the more you earn, the bigger responsibility you have. Di ba? Ma-promote ka, na-earn nimo na siya. Pero ang responsibility nimo is getting bigger and bigger. So nga na siya. That means ang imuhang stress madagdagan. Imong stress madagdagan. Or ang factors nga nagka-cause og stress sa imuha madagdagan. Where pag dili nimo na siya ma-control, it will result to depression. Okay? Other role transitions may be accidental or not predictable. An individual may develop a serious illness or disease, may be injured in an accident while at work or somewhere else, or have deal with losing house to fire or flood. So, excuse me. So, there are roles, again, nga unexpected sa isang kisap mata lang, nagka, na put na ka into situation nga dili ka sanay. No? For example, ah nagkape ka sa dalan, nagkape ka sa tubangan sa inyong balay. Sa inyong balay kay naidalan, no? So, habang masaya kang nagkakape, may sasakyang bumangga sa iyo. So, pag mata nimo, putol na imong tiil. So, ikaw ang nag-earn para sa family, naputlan kag tiil, or nagkaroon ka og kumbaga karing problema physically, 'di ba? Dako kay na siya nga problema sa ato, dako kay na siya nga stress factor. So nga na, karang mabalaan nimo nga na kay sakit, no? Bawalan na ka mag-ingani, bawal na ka karang pahago-hago kay basim atakihon ka sa heart. So nga na, dako kay siya nga stress factor. Kumbaga, na kay role nga ma-perform before na siya nga event. Which is, after nimo na learn ang imong condition or after nimo nabalaan ang imong condition, maka-apekto siya dito sa imong role nga gina-perform. Okay? In those who develop depression, these transitions are experienced as losses and hence contribute to the development of psychopathology. Individuals who are prone to depression may when faced with one of these situations, see their situation as hopeless or out of control. So there are people nga no, iba-iba man gyud og capacities. Iba-iba man ta og mindset. And we have motivations from different sources. No? There are people nga bisag stressful na kayang situation, they can cope with it. No? They can cope with it. But there are people nga always thinking as ilang situation as hopeless. No? They are thinking nga wala na wala na kasulbaran ng ilang situation. Those people are more prone to depression. Okay? Compared to people nga na ay coping mechanism. Na ay coping skills. Okay? Interpersonal deficits. The person has a history of problems in beginning or maintaining relationship with friends, relative, or others. So, when we say interpersonal deficits, history of problems in beginning or maintaining relationship. Kumbaga, na yung mga taong they cannot maintain their relationship with others. Kumbaga, karing dili po tong to the extent nga karing ilis-ilis ug uyab no. Pero karing dili gud kay ka okay mag-handle og relationship. Dili man to the extent nga karing you are karang problema gud nimo kay magsawa. Not dili sa nga na. But karang the way you communicate with them, 'di ba? The less sometimes I'm good pag less ang atong communication with our friends, our loved ones, that will create a barrier between us. No? Magkaroon tag hesitation, kaulaw, and others. The person talks about feelings lonely and separately from others. Although these feelings are long-standing, they may become worse after one of the problem surfaces. such as move to a different town for a new job. So, uh, another example sa interpersonal deficits is karing ingani mag-move ka into one place, no? So imuhang imuhang mga nakasanayan nga mga tao is na dito sa imuhang place of origin. Tapos kalit lang ka mo jump into another town nga wala kay kakilala. So nga na siya, wala kay close, and another adjustments, you have to build relationships with them, build rapport. So nga na. If you na kay problem, no, pag magkaroon kag problema while on that place, then sometimes wala tay maingnan kung unsa to ang problema. Kung magsakit ta dira, 'di ba? That's why there are people, for example, OFWs. Tong na experience nila kaysa there are OFWs nga wala na gyud nagtend nga magbalik. Mag-go abroad ulit. So nga na siya. Goals of interpersonal therapy. Reduce symptoms of depression. So what are the goals of IPT or interpersonal therapy? So number one is to reduce symptoms of depression. Major goal of IPT is to change interpersonal functioning by encouraging more effective communication. If na-depress sila because wala sila kumbaga, karang ginatawag na to nga, na-depress sila kay they think walay laing tao nga maminaw sa ila ha. That's because they nag-hesitate sila or maulaw sila mag-communicate with others. No? Then, dapat nato na siya matarget. Emotional expression. Maulaw siya mag-express sa unsayahang na-feel. Karing, sometimes diri mag-result into euphemism. No? And anyway, this is all connected with psychology. No? We have, kumbaga, kung ang isa ka tao walay kakayahan mag-express sayang emotions, no? Diri ma-develop ang ato ang ginaano nga defense mechanism. Denial ba and others. Bisag dili na gid okay, mingon lag okay lang man, kaya lang. So inga na siya. But deep inside dili di ay. So kinahanglan in IPT matarget nato na siya nga behavior. Increased understanding of behavior in interpersonal settings. Individuals are helped with the mourning process and to deal with their sadness. So, in IPT, we help our clients or our counselees in mourning process. Kung yung tag mourning process, mauna siya katong, when we say mourning, katong ilahang paglong, no, ang ilahang kamingaw, ang ilahang kumbaga hinanakit for something sa pagkawala ba sa ilang loved one or anything or others. So we help them cope with it during sa ilahang mourning. Okay? And deal with their sadness. Help to reestablish interest in relationships and become involved in both relationships and activities. So, dili man nato na sila matabangan in tambag-tambag lang, advice. Of course, we should help them kumbaga magkaroon sila og knowledge on how to build relationships, paano mag-communicate, kung sa ilahang dapat tun-an o iwasan. They are helped to develop strategies to resolve the disputes or to bring about change in an impasse. Sometimes they may change their expectations of their problem and relationships with others. Seeing the new role as more positive is one goal. 'Di ba? Kung nagkaroon ganin siya og kalisod sa iyang role transition, no? Alisod man oy. In based on my experience, so I served as uh, the Department President of Social Work, PSSW, I mean, the Social Work Department for 2 years. So, pag high school na ko, wadyo ko nakatry nga, wadyo ko nakatry nga, ma-officer. Kung ma-officer man ka, dito ka Sergeant at Arms. Pero karang naka sa higher position, wala ko enough experience about that. So, this situation, pag-abot na ko og second year, I was elected as secretary of the department. Wala ka kabalo kung unsay imong role. So nagkaroon ka o na-shock ka sa imong bagong role nga na secretary ka. Then after 1 year, ikaw na ang na-elect as president. Kumbaga wala gani kay enough knowledge about that. Ikaw pa gid ang na-elect. No? So, ikaw man ang kumbaga lisod man siya ang imong role kay wala kay idea. But in interpersonal therapy, we are looking for the bright side of that role. Ikaw ang president sa department, ikaw ang magpamalakad. No? Ikaw ang magplan, though lisod man siya. Ikaw ang everything, halos. Kung wala ang program head, ikaw sa ang mag-lead. Nga na ba? So ikaw, maglisod ka, bugat ka na siya nga role. Pero you look at the brighter side of the role. So matrain ka as leader. Imong leadership skills is ma-develop. So nga na siya. There are roles no nga lisod gid siya. There are roles nga lisod siya i-perform. That's because we are thinking lisod siya. Or we are thinking about karing what if we fail? But we look at the brighter side of that role. Then dira tama ka og source of motivation nga buhaton nato ato ang best to perform such role. Okay? So nga na siya. That is one of the goal of IPT. Ang imuhang role as a student, kapoy, lisod, ana siya. But look at the brighter side of the role. After 4 years, pwede na ka maging professional. Ikaw na pod ang magpalisod sa estudyante. Char. So, inga na siya in interpersonal therapy. Ginataga na to sila og motivation nga mag-pursue. Sige na. Instead nga, kumbaga ang source of depression, di ba? Ang source of depression is ang bagong role nga i-perform. Ilahang doubts sa ilahang self to perform such role. But when we look at the brighter side of that role, no, the benefits, then dira ta makakuha og motivation nga i-pursue na siya nga role or i-perform. Okay? Develop a sense of mastery of a new role or roles and thus increase self-esteem. No? So, pag ma-motivate na nato atong client, sa una-una lamang gyud lisod ang isa ka role, di ba? Pag una-una as for example, teacher, no? Sa una-una because wala pa man ka enough knowledge about that role, normal lang gyud nga na ay failures. Normal lang gyud nga na ay kumbaga lackness. Because namanggod na pud ibang tao manggod, especially karing mga perfectionist. Gusto nila perfect tanan. So, we cannot blame them. That is nagyo nga na nga behavior. So, perfect tayon. Pag dili sila masatisfied sa ilang performance, ma-stress sila og maayo. Ma-discourage sila. So, magbaba ang ilahang self-esteem. Ay, dili ko effective nga teacher. Ay, dili ko effective nga employee. Mag-resign na lang ko. So, there are sometimes nga na ang situation. No? But, wala nila siguro wala nila na realize or dili nato ma-realize nga we are still on the learning process. Bag-o lang na sa tuang role. So we have to learn it. We have to master it. So how can we master it if we surrender? Singa na siya. Goals are to develop new relationships or improve ones that may be superficial. Okay, another is to build or to develop new relationships. Depression came pag ang isa ka tao feel nila they are alone. Then we should target that one in IPT, no? Help them build or develop new relationships. Okay, interpersonal therapy. Focus on the importance of interpersonal relationship in determining behavior and psychopathology. So, the focus of interpersonal therapy is, again, the importance of interpersonal relationships. So, problem nag-exist sa tua or ang depression, ang stress nag-exist. That's because sometimes there are people nga, kumbaga, when it comes to interpersonal relationship, hina sila or dili sila kabalo mag-develop or mag-create og interpersonal relationship with others, communicate with others. So nga na siya. Interpersonal therapy. Major goal of treatment, change interpersonal functioning by encouraging more effective communication. So the same with a while ago na mention. IPT assumes that by improving a relationship, symptoms in patient's life in general will improve. So, if ang source gani of dysfunctioning is ang relationship with others, no? Na they got depressed because they think they are alone, they have no one to tell their stories. Then, kara ang gina-target sa IPT para maiwasan ang ilahang dysfunctioning. So, pag ma-target na sila, then, patient's life will be improved. So, nga na siya. Role of the therapist, patient advocate, not neutral. Patient advocate, kita ang mag-fight para sa kung unsa ang ikaayo sa atuhang client. We're not neutral, karang kumbaga, dili nato sila, sometimes we discourage self-determination diri. If ang iyahang decision is dili makatabang sa iyahang situation, no? Pag dili gani makatabang sa iyahang situation, ang iyahang decision, we should advocate for it. Fight kung unsa ang dapat. Active, not passive. So kinahanglan si therapist diri or si counselor sa ingani sa IPT, no? Sa IPT ang kinahanglan si counselor is active maminaw, active motubag sa mga pangutana, active kumbaga hatag og mga words nga need sa ato ang counseling. Dili kay passive. We should show our interest. Ano siya? Therapeutic relationship is not interpreted as transference. When we say transference, ang kumbaga, the attachments nga na-develop sa atoang client sa atoa. And counter-transference if kita ang maka-feel ana towards our client. So, when we say therapeutic relationship, ang purpose niya is for helping, for therapy. No? Dili siya transference. We build that relationship because someone is in need of help. And we need to build trust or rapport with them para magkaroon sila og confidence to impart their whatever comes into their minds. That is not transference. Therapeutic relationship is not friendship. Okay? We can be friends with our client or with our counselee, but we should think nga the purpose of that relationship is to help. Hmm, so, saba kayo. So, the purpose of that relationship is to help our client. No? That's more than friendship, I think. So, nga na siya. Techniques of interpersonal therapy. So, techniques, when we say techniques, this is how we do interpersonal therapy. Clear approach, that's why it can appear to be mechanical. Clear approach. There are people, di ba, namang guro tayo friends, nga, murag na depress. Murag siyang na depress because, karang, dili gid siya totally depressed. Pero feeling lang niya. Di ba? Or, nagyod tayo friends nga na depress. Karang, atong approach sa ilaha is something nga we have the interest to listen. Because pag ma-feel nila nga marag napugos ta or we are not willing to listen, dili na sila mag share, dili sila mag-talk about it. They will use their defense mechanism instead. So tinuod man, okay? In conducting interpersonal therapy, therapists should do in 3 phases. Initial session, atong first ninyong kita, and others. Immediate session. So, sa helping process, ang initial session is data gathering, building rapport, no? Mag-collect tag data sa atong client. So nga na. Intermediate session katong ato nang hatag ato ang interventions. Ato nang gihatag ang services nga kinahanglan niya. Then termination is after na sa dalawa. Termination. I-end na nato ang helping process. Okay, initial session. Dealing with depression for clients nga na ay depression. Use assessment inventories. Explain depression as a medical illness, not personal weakness, and explain the treatment. So, direct to the point kayo, no? We should explain what is, but since we are not psychologists, we're not psychiatrists or any mental health professionals, no? So, sometimes, di gid siya enough nga kita ang ang mag-discuss about ani sa ato ang client. But, kumbaga, we have the knowledge man, then we can, kumbaga, educate our client what is depression. Give the patient the sick role, supportive of the patient and show him that there is hope. So nga na siya ang sa initial session for clients nga na ay depression. Okay, wait for a while. Next, relation of depression to interpersonal context. Number one, review current and past interpersonal relationship as they relate to current depressive symptoms. Determine with the patients of the following. Nature of interaction with significant persons. Kumbaga, we should know kung kano sa pa naga-exist ang iyahang, kumbaga the past relationships. So nga na siya. Kung unsa na ba nakadugay nga na nga problem ang iyahang problem about interpersonal communication or relationships. Kung maulawon gid siya since bata pa, no? Then maybe that is isa siya sa factor. Nature of interaction with significant person. Nature of interaction, friend ba niya, family members, or sibling? So nga na siya. Expectation of patient and significant persons from one another and whether these were fulfilled. Unsa yung expectation, for example, iyang friends. So unsa yung expectation sa iyang friends? Abi nako sila ang makatabang sa ako asing aning nga panahon nga or situation. Pero dili di ay. So there are people nga na, no? So, ingana siya. Tapos pag-abot nimo dito sa friends, siya di ang naga-resist, ang dili gusto matabangan or naga-refuse. Ingana siya. Satisfying and unsatisfying aspects of the relationships. So, how can we strengthen relationship if we do not know their satisfactions, no? Asa sila dili satisfied. Changes in patient wants in the relationship. Tong from best friend to boyfriend and girlfriend. So, dili day sila gusto sa maging ingan na kay masayang ilang friendship if ever. Char. So, ingan na sa example. Identification of major problem areas. Determine the problem are related to current depression and set the treatment goals. So we should determine what are the problem area nga connected ito siyang current depression. So for example, depressed siya sa iyahang trabaho sa baong nga role nga iyahang gina-perform. So that's because ang problem area dito kay wala siya enough nga knowledge about it or dili niya kaya ang stress. Nga na. So we should determine asa nga part siya nagka-problema. Determine which relationship or aspect as of relationship is related to the depression and might change in it. So, in a certain relationship, we should know or determine kung asa nga aspeto, no? Kung asa nga aspeto dito ang naga-cause of depression para ato ang ma-change. So, nga na siya. Next, explain the IPT concepts and contract. Outline your understanding of the problem. So, unsa ang imuhang pagkasabot sa iyahang problema? Sa imuhang buhatan og outline. Agree on treatment goals, determining which problem area will be focused. So, sa tanan problema, there is one problem nga immediate or ang urgent or the root cause of the problem. So, we should determine kung unsa nga problema ang dapat ma-focus. Describe procedures of IPT here and now. So, agad-agad, i-explain na to unsa ang procedures sa interpersonal psychotherapy. Review of current interpersonal relations, discussion of practical aspects of treatment, the length, frequency, times, fees, policies of means, appointments. So, mao ni sila ang procedures, no? Discussion of practical, review of current interpersonal relations. Unsa ba ang iyahang, kumbaga, ato ang kay kayon, ang iyahang interpersonal relations. Discussion of practical aspects of treatment length. Kung unsa kataas ang ato ang treatment. The frequency. Unsa ka dalas. No? Times. Fees. And of course, policy for missed appointments. Pag dili gani makasipot ang imuhang client sa on day sa imuhang schedule for treatment, what will happen? So dapat na policy. In the initial stage, the therapist encouragements and reassurance help build a therapeutic alliance with the patient. So kita as social workers or counselors, no, we act as a resource. For the meantime, kita ang source of support. So, encouragement and reassurance help. So, that creates therapeutic alliance. May salig na ang imuhang client sa imuha. Of course, participation and cooperation is possible. By becoming up with a specific formulation of how the treatment is to proceed, the stage is set for the middle phase of therapy. Okay? The intermediate session, interpersonal therapist uses different strategies for each of the 4 areas. Interpersonal, karing tatlo ang apat gaina. So, in different problem or situation. For intermediate session in the grief, goals, facilitate the mourning process, no? Natay, nabakay, mga stress debriefing nga buhaton para ma-relieve lang siya. Help the patient reestablish interest in a relationship to substitute for what has been lost. So, on process pa siya or napa siya sa grief stage or nag-mourn pa siya about unsa ang na-lost sa iya. Diba, sometimes we motivate them by imbes dito iyahang attention sa kung saan nawala sa iyaha, dito nato gina-motivate nato sila by making them aware or conscious kung unsa ang pwede nila i-replace dito. Di ba? Bulagi na mong uyab, daghag lakis kalibutan. Nga na siya, mas gwapo pa dira. So, di ba? Or, ma'am, tama na imuhang kay napakay mga anak. So, maapektuhan imong anak kung ingana ang imuhang situation. Maapektuhan ang imuhang role as a mother or as a father kung ingana ang imong situation. So, strategies, review depressive symptoms. Unsa ang naging symptoms ana nga like dili siya mukhaon, wala siya interest in things nga kumbaga wala siya interest sa makig-talk with other people, mapabayaan ba niya iyang sarili, no? Dili niya ma-perform iyang role. So we should determine what are the symptoms of depression. Karang iba na ba iyahang madamguhan? Karang gamayng lihok ma-feel niya nga naa didto, iyahang nawala nga loved one. Char. Okay, relate symptoms onset to death of significant other. Next, reconstruct the patient's relationship with the disease. So, kung sa manilang relationship, we cannot change it. but we can reconstruct the patient's relationship with the people nga ilahang na-loss. Sige na. Describe the sequence of the consequences of events just prior to, during, and after the death. So, naka-try ba nga, okay na lang po na siya nga, na mahuway na gid siya kaysa naman mag-anto siya. Makita nimo nga nagalisod pa siya. So, there are situations nga na, di ba? Kumbaga, the consequences katong naa pa siya and katong wala na siya. Okay na na mari kay karang dili na siya maglisod, dili na siya magantos, na mahuway na gid siya. So diba, di nga na ang commonly so yung atong ginagamit as motivation. So nga na. But there are people pod nga dili pa jud na kaya nga ingana. No? Because they nagwi something sa relationship nila which is kumbaga lisod yun siya dawaton. Explore associated feelings, negative as well as positive. Katong iyang hinanakit o ang iyang positive feelings. So ato ang discover. Consider possible ways of becoming involved with others. Okay? For interpersonal disputes, so kato mo to siya ang for grief. Now let's talk about interpersonal disputes. Goals, identify dispute, choose plan of action, modify expectations or faulty communication to bring about satisfactory solution. So, limit lang man gud ni siya for 1 hour ang recording. So, i-hurry na lang nato para dili na ta mag-add og other video. Okay, so again, identify disputes. For interpersonal disputes na siya ha. So, when we say interpersonal disputes, these are situation kung asa ang relationship between two or more persons kay na ay problem. Like for example, nag-aaway nga mag-igsuon. No, that is interpersonal disputes. Or away sa silingan. Away sa imong boss, sa imong ka-workmate. Sige na. So, goals, identify disputes. Unsa ang problema sa ilahang relationships or unsa ang cause nga nagka-problema ang ilang relationship. For example, sa may igsuon nag-away tungod sa yuta. No? Magparente nag-away tungod sa yuta. Mag-friend nag-away tungod sa utang. So nga na. We identify disputes or the causes of the problem. Choose plan of action. So, unsa ang ato ang himuon nga action? Like, makipag-ayos ba? Makipag-areglo? Mo-file og kaso? Or anything? Modify expectations or faulty communications to bring about satisfactory solutions. So, sometimes they are aware nga okay na gani makipagbati na gani ang pika side. Sila pagyud ang modili, ikaw pagyud ang modili, di ba? Or makipagbati na gani ka sila pagyud ang modili. No? So, that's because there is something in the communication. Yung problem when it comes to communication. Or nag-hesitate lang. So, we target that one. Strategies. Review depressive symptoms. No? Dili maiwasan nga ma-depress pug ka sa problema nimo sa ibang tao. Relationship with other people. No? Unsa ang naging symptoms? Ka-develop bag fear, kay na anuhan og sundang sa silingan, madok na. Unsang naging symptoms? Relate symptoms onset to avert or covert disputes with significant other with whom patient is currently involved. Determine stage of dispute, renegotiation, calm down participants to facilitate resolution. So, kari siya usually mo yung ginabuhat sa barangay in resolving conflicts. Or even us when we try to resolve conflicts. Renegotiate. No, dili man na ma-solve kung dili na to i-negotiate ang both parties. Calm down participants. Dili man na siya sa face-to-face nga. Nagkumutanay buhok, nagsagpaanay, nagsumbaganay. In face, increase harmony in order to reopen negotiation. No? We cannot solve problems pag duha ka ba magsyagitanay. Singan na. We should have harmony first. Then, dissolution assist learning. No? Kung labay manghilak sila ha, then we assist them. Hindi po tong gulang hilak lang. But we help them feel nga makalm sila, makalma. Okay? Understand how non-reciprocal role expectation relate to dispute. What are the issues in the dispute? Unsa ang issue na nag-cause sa ilahang away? No? What are the differences in expectation and values? Ang pamatasan o ang ilang expectation. So, namang ginadra usually. Expectation, ma-okay. Pero, ang batasan or ang ugali, pag-uugali during ana is, dili pa gid siya. Feel nimo dili gid maging okay. Like, excuse. Like, friend na ta ha, pero nagmugot gyapon. Oo, friend na ta, okay na ta, pero nagmugot gyapon. Okay? Pag sa mga bata nga na. What is likelihood of finding alternatives? So, we find alternatives. What resources are available to bring about change in the relationship? Unsa ang available resources sa ilaha ba? Or na ma-offer imong agency or ikaw? No? So, dili na siya, dili na siya, sometimes, dili na siya always material. That's sometimes non-material. Internal resources to solve the problem. Are there parallels in in other relationship? How is the dispute perpetrated? So paano nahimo ang cause sa problem? Or paano siya nag-start? So that's it. Is the patient gaining? Nabay na earn ang ang client, no? Sa imuhang naba siya na-gain? What unspoken assumptions lie behind the patient's behavior? How is dispute perpetrated? Okay, so skip na nato ni. For role transition, nga problem, goals, meaning and acceptance of the loss of the old role. Di ba? Sa ato ang role, like for example, natanggal sa trabaho, you have friends there, kumbaga na kay mga relationships nga mabiyaan. So, magdisod tag-adjust about it. No? So, iyahang acceptance, meaning and acceptance, kumbaga ang iyahang grief sa pagkawalaan ng role. For example, ikaw as teacher, na kay na develop nga relationship with your students. Then, kalit ka, karang need na mo mag-resign or retirement, No, you love your job, then imuha pang co-teachers, imong co-employees. So lisod siya. So meaning and acceptance. Acceptance is the way niya i-accept ang iyang situation. Tigulang na gid ko. Need na gid ako mag-retire. Kapoy na pod. Though mamiss lang gid ako ang teaching. So nga na, for example. Then help the patient to regard the new role as more positive. Tama na pod na ma'am kay at least makapahuway-huway na ka, kay tigulang na ka. For example lang, ngani. But for situations nga karang need gyud nila ang trabaho, no? For example, is unemployment, need gyud nila ang trabaho, di sa siya comfort. But we do our to look at the brighter side of the problem gani. Pwede man siya mga apply balik. Sige na. You have the skills man, namang kay skills, namang kay job experience, namang kay license. So pwede ka mag-apply. Sige na. Restore self-esteem by developing a sense of mastery regarding demands of a new roles. That's why lamang ang may experience, di ba? Para dili kay sila ma-list down. Ay dili man ko HR no. Di man ko ang hire pero lamang ang may experience because dili sila maglisod og adjust sa role may hatag sa ilaha. Sige na. Strategies, review depressive symptoms, no? Unsa ba ang naging outcome sa pagkawala sa ingalahang role or unsa ang naging outcome sa pag-abot sa ilang bagong nga role? So naamang gyud na. Like makulbaan, maglisod og adjust, and ever. Relate depressive symptoms to difficulty in coping with some recent life change. Review positive and negative aspects of old and new roles. So kumbaga, we do comparison. We do comparison. Kung katong dati niya nga role o karon nga role, which is more beneficial or asa dito ang mas okay para sa iya. No? Explore feelings about what is lost. Kung unsa iyahang na-feel sa pagkawala sa iyahang role. Like for example, natanggal sa trabaho, unsa iyang na-feel. So normal, mas sad, no? Okay? So explore feelings about the change itself. Unsa iyahang na-feel about sa change, no? Naglisod akong family, naglisod ang nasakitan ko ka naglisod akong family. So that is if it is related sa job. But not all roles are related to job. So we cannot say or we cannot determine what's unsa iyahang feeling, no? Depending on what is lost, no? Explore opportunities in new role. So dili na siya always negative, no? A new role is an opportunity, no? A new role is an opportunity. So unsa ang mga mag-gain niya in that role? Realistically evaluate what is lost. Encourage development of social support system and new skills called for a new role. Okay. I think we're done with this interpersonal deficits. Then we do termination after sa tuang helping. Explicit discussion for termination. No, dili man pwede nga. Dili na to ingon nga about to end na ang therapy. Of course, we have to tell our ato ang client nga about to end na ato ang therapy. Acknowledgement, the termination is time of grieving. Move toward recognition of independent competence. No? The reason nga kinanglan nato sila matudloan og coping mechanism or coping skills is for them to be independent.